It's my pleasure today to introduce Chris Bergerot, who is both a psychologist and researcher with particular expertise in psycho-oncology, health psychology, and improving quality of life for people with cancer. Chris, welcome and thank you for talking with us today.
Hi, Amanda.
Just to start off with, I wonder if you could talk to us a little bit about how patient-reported outcomes have been incorporated into oncology research and practice.
Yeah, I think it was like a great point for us as psychologists and also for our patients. So patient-reported outcomes are being increasingly incorporated into oncology research. And I think the great point for us is that ASCO and ESMO have supported this incorporation. And also the United States FDA, they did like some formal recommendations in how we should like assess our patients, and even that what type of domains we should access. So basically they recommend us to access physical functioning, disease-related symptoms, and adverse events. And I think I know that you're also a psychologist, and it's really like curious to know, considering all the data we have from the psychosocial perspective, why they have not like included emotional symptoms on this list. And even because we already know that this emotional symptoms can impact on patients' tolerance to of treatment, and also can impact on treatment experience and clinical outcomes. So I think this is the next step that maybe we can try to advocate, or even try to better understand to make this a reality to our patient. I definitely believe that this will really change the way we are treating our patients nowadays. But focusing on prostate cancer, so new therapy, all these new therapeutics that we have available right now have dramatically improved their overall survival and even their quality of life. We know that all these patients with androgen deprivation, they frequently have some disease-related symptoms, such as joint pain and also fatigue, or sometimes they have some reduced physical functioning. And they also have like some short and long-term side effects, including fatigue, sexual function, hot flashes, enlargement of nipples and breasts, and also sleep disturbance. All of this is sometimes it is hard to follow, and is also hard to include in the clinical trials, because it is some of those are related to their surgery, or even to their disease, or maybe also to this new treatment. But continue to include the PROMs in our studies will help elucidate the effect of all these treatments on our patients' outcome and quality of life. So ideally, the PROMs, they will assist in providing high quality care, and also improve patients' overall experience and communications between patients and their healthcare providers, and will also improve some symptomatic management. But when I was reviewing all these PROMs data across multiple trials in metastatic renal cell carcinoma, in metastatic castration sensitive and metastatic castration resistant prostate cancer, the most frequent used PROMs included the FACT-P, specific for prostate cancer, and the EuroCall is the EKI 5D. Some of those also include the 5L, and also the brief pain inventory. So we know that the FACT-G has the emotional domain and also the social family domain. However, there are some studies that have included this in their analysis, but most of them just focus on global quality of score. So I can tell you that from the 13 studies that I have reviewed, just 3 have described the impact of these drugs on the emotional and social and family subscales in their results section. Other than that, they tried to focus on changes from baseline in fatigue, or even in quality of life and in pain, and time to deterioration, or time to pain progression. And this is just more one data that was not like very well explored.
Right. So although there's less data available on those emotional aspects, can you speak to particular points in time when men may be experiencing more distress or more emotional symptoms?
Sure. So for those patients with metastatic disease, I would say that every time when these patients will need to switch to a new treatment. So every time when they face a new progression, they will have more distress. And for those with localized disease, in the specific case that their definitive treatments don't work, so these patients will have to cope with recurrence and with their fear of cancer recurrence. So they will, every time when they have to do their PSA and to check their results and to see how is everything going, probably these patients will be feeling more anxious and more insecure with their current status.
Okay, thank you. And how do you think we can best respond to that distress?
I would say that first we will need to better screen these patients. So we have a lot of studies that saying that usually the current measures for anxiety and depression, it is not like the best one to access anxiety in prostate cancer. There is one that was developed by Andrew Roth at Memorial Sloan Kettering, and I think this one is a really good one. This can help us to better understand how these patients are dealing and also how they're coping with their disease. And I think with this information, it will be easier for us to develop like a treatment plan and also to develop some strategies to better target their emotional and unmet needs. For sure that screening, at least for me, it's the first option. But we are, I think with this COVID situation, it's hard for us sometimes to screen our patients. We already have like some how do I say, like some, we can also access these patients using some apps or some programs or even through telephone or something like that. And I think this will be really useful for these patients. But there are like some programs too that can also target these patients, considering all the data we have available in the literature. We maybe should like try to develop some interventions, that can target all their unmet needs and that can help them to better cope and also to better face all the challenges that during their disease, during the continuum of their disease.
Right, so we need to really screen people to understand and identify the distress and then develop appropriate interventions for managing that. You mentioned COVID briefly. I know we don't have a lot of time, but I just wondered if you could speak briefly about how you think COVID might have impacted patient wellbeing.
Yeah, I think it will be really interesting to understand not only for those that currently have prostate cancer, but but I will also include those patients who are screening for PSA right now, because I think the access to care is a little bit tricky to get right now. So we are experiencing a lot of delays, and also some people are prefer to stay like at home instead of trying to keep their self-care. So yeah, I think right now the feeling for even for men, when we think about men, loneliness, loneliness. Yeah, I think it will be. I think it will have like a great impact on their clinical outcome right now. There are many studies that saying when male are more alone, are alone or doesn't have like a good social support, these patients will have a lot of trouble in their treatment, and will also do not like adhere to the physician's recommendations. And so I believe that all of this previous knowledge that we have about men will probably be like more evident right now with this COVID situation.
Right. So something that we've known is important for people in general is perhaps even more important and exacerbated under the current circumstances.
Yeah, yeah. I think we should like definitely try to be more proactive as a healthcare team. Like we need to be more proactive and try to reach more of these patients, to really try to understand how they're doing and if they need any kind of support or if they need any kind of assistance. And if they have, even if they have any doubts or if they need any kind of information regarding their healthcare status or even if they're like or even related to COVID. So I think we will need to be more proactive right now, even because I don't know when everything will go back again to normal.
Yeah.
So for sure we should like be more close to them and trying to really get a better sense of how they're coping with everything and how they're dealing with all this change and if they're taking their medicine, if they're doing their scans in the correct, like in the in exact when they really need to do it. And so yeah, I think we'll definitely should be more proactive right now.
That connection and communication is so important. And I want to say thank you, Chris, for connecting with us today. I'm sorry that we weren't able to do this in person, but thank you for joining us.
Oh, thank you. And it was a really nice pleasure to meet you, Amanda. Thank you so much.
Thank you.